Hello, Mr. Woods. My name is Dr. Erwin. So, I've been working on your case and just got your test results back, and your kidney disease seems to be causing all your symptoms, mate. So, your kidney disease is causing anemia, and it's getting to the point where we're going to have to do a blood transfusion, a whole blood transfusion, alright? Can I confirm your name and date of birth, sir?
Of course, Doctor. Our name is Tiger Woods. Birth date, December 30th, 1975. We're in our 14 PGA major tournaments. My main concern is, will I ever golf again?
Oh, yes, sir. Luckily for you, it's a pretty common procedure. You certainly should be able to golf again. Now, the next step in the process is for me to get you to sign this here consent form, alright? Sign this, and we can get right on in the process. Luckily for us, your blood type is AB positive, so I can give you pretty much anything that's lying around, alright? Now, after I have you signed this consent, is there anything else I can get for you before I send my nurse in there?
Yes, sir, Doctor, of course.
The only thing I would ask for is maybe another pillow. I only have the one right now. And here's your consent form, Doctor. Of course, sir. I'll send my nurse right in with some pillows. They're going to ask you a few questions, and then we'll get started on that blood transfusion. According to my medication administration record, the doctor has ordered a blood transfusion for Tiger Woods. Come on in! Hi, my name's Nick. I'm going to be your nurse today. So I just confirmed the doctor has ordered a blood transfusion. So I saw that he has received consent from you, which is great. You just need to do a few things before we begin this whole process. And I brought you some pillows, so hopefully you're comfortable now. First, I have to check your IV site. I have a flush here. It's not medication, it's normal saline. You might smell like a little salty smell, but that's all. I'm just gonna check this. Simulated line flushes. All right, perfect. So now I'm gonna obtain some vital signs from you. I'm just gonna take your blood pressure real quick. Simulated blood pressure 126/82. Simulated pulse 84. All right, sir. So basically, we have a dedicated IV line for you, which I'm going to be transfusing blood products through. Do you have any other questions at this time?
I certainly am more comfortable now.
Thank you for the pillows, Nick. My only question is, will there be any side effects, such as death? Well, Mr. Woods, if there is a transfusion reaction, some of the common adverse effects are shortness of breath, flank pain, hives, a headache, chills, an increased heart rate, and hypotension, which is a lowered blood pressure. I will be with you and monitoring you for the first 15 minutes at the beginning of the transfusion. If there is going to be a reaction, normally it happens within the first 5 to 15 minutes. And now I'm going to go and get the blood, and I'll be right back. This process can take a little while, up to 4 hours, so I would suggest going to the bathroom and emptying your bladder before we begin.
All right, just coming back from the blood bank.
Morning! Hi, Mr. Woods. It's me, Nick again. Just provided some patient privacy. So I've got your blood, I've got some normal saline. I've got another nurse with me here that you've already met, because we need to do a double check. We need to check some things off here. Double confirmation. So, alright, patient's name is Tiger Woods. Date of birth, 12/30/1975. Simulated, confirmed ID band. Alright, his blood type is AB positive. Donor type is B positive. They match. They're compatible for transfusion. Unit number 12798654342. Expiration date is 4/15/2020. And I'm going to turn it over to you. Yes, let us make this quick since you were interrupting Ivan's lunch break. So, patient's name, Tiger Woods. ID band, match. Blood group AB positive. Donor B positive. Cross match compatible. Blood unit number 12798654342. Expiration date 4/15/2020. Blood product matches MD order on electronic health record. And blood product free of clot or any hemolysis. I go now. Okay, Mr. Woods, we're just about to begin. Boom. CDC ain't got nothing on me. Hand hygiene all day. Alright, just gonna put some gloves on here. Okay, so I need some special tubing for this called Y tubing because we're going to have one line with saline and one line hooked up to the blood products. Going to prime the line with saline. Alright, so I've spiked the normal saline bag in the usual way in accordance with hospital policy. 500 ml saline. And I have Y tubing hooked up to a filter. So here's the filter drip chamber. I'm going to squeeze that. Boom. Simulated. Filling up with saline partially. And I'm going to open the lower clamp and prime the line. Lower clamp. Open. Wow. Gravity did a quick job on that. The line is now primed, so I'm going to close that. Alright, so now my blood simulated inversion. I inverted the blood product 2 times, hung it on my pole, spiked the bag, and now I'm going to open the clamps and allow the blood to cover the filter. Opening simulated clamp. Boom. Alright, so now once again, Mr. Woods, can you confirm your name and date of birth? And I'm going to double check that with your ID band. Oh yes, of course. Name is Tiger Woods. Birthday 12/30/1975. Oh, here's my wristband. Alright, thank you for confirming that for me again, Mr. Woods. And we're beginning the transfusion now. I'm going to be with you for the first 15 minutes. Every 5 minutes I'll be checking your vitals just to make sure that you're accepting the transfusion well. And then after that, I'm going to be making my rounds. I'll be back every 15 minutes for the first about hour of your transfusion to check on you. And then I'll be back hourly until the transfusion is complete, which will take 4 hours. And I'm just going to go ahead and do some hand hygiene, do some documentation, make sure you're safe, bed is lowered, side rails up, you have the call light right there, sir. Is there anything else I can do for you right now? How are you feeling? I'll tell you what, I feel like I just won my Nike contract back, aka, alright.